This is temporal bone. It is bilaterally present. It is irregular in shape and it is a type of pneumatic bone. It has few parts: a squamous part, a mastoid part. This one is petrous part. It is petrous part. This one, and a stelloid part. So we have to hold it like this. It is present at the side of skull. If you see a real articulated skull, so in this part temporal bone is present bilaterally. You can see here this one. This is the temporal bone present. Here is the parietal. This one is temporal, and it is present bilaterally this side also. So it forms a part of temporal fossa. First, coming to the squamous part. So squamous part is a thin plate of bone which projects vertically upward. So this is thin plate of bone projecting vertically upward. It is translucent. So it has a external surface, a internal surface, one superior border and antero-inferior border. So superior border, if you see, it is beveled inside. This is beveled inside and it articulates with the parietal bone. Okay, and this antero-inferior border, this border articulates with the sphenoid bone, squamous part of the sphenoid bone. So it has an external surface. External surface is smooth, and this surface gives attachment to temporalis muscle. And if you see here, there is a groove for the middle temporal artery. On external surface you will also found a zygomatic process. So zygomatic, this is zygomatic process. It has a base which is attached to the lower part of the squamous part of the temporal bone, and the base, this is the base, and you will get a apex. This apex articulates with the temporal process of zygomatic bone and form a zygomatic arch. After articulation with the zygomatic bone, it completes the zygomatic arch, which you could see in articulated skull. See, this one is the zygomatic arch. This is zygomatic arch. This is superior border. This is superior border which articulates with the parietal bone. This is antero-inferior border which is articulating with the sphenoid bone, and this is zygomatic process, and the apex of zygomatic process is articulating with the zygomatic bone to complete the zygomatic arch. So this zygomatic process has a base. Base is attached to the squamous part of the temporal bone. It has a concave upper surface, and this concave upper surface transmits the tendon of temporalis muscle. The lower part of the base, that is the inferior surface of the base, it forms the articular part of mandibular fossa. So mandibular fossa has two parts. One is the articular part, another one is the non-articular part, and both is separated with the squamotympanic fissure. Okay, so the base of zygomatic bone forms the articular part of the mandibular fossa, in which what articulation is present? The condyle of mandible articulates here. Okay, so here articulates the condyle of mandible. Now it has an apex which articulates with the zygomatic bone. The upper margin is sharp. Upper margin of zygomatic process is sharp, and it gives attachment to the temporal fascia and glia aponeurotica. Lower margin, this lower margin of the zygomatic process gives attachment to temporalis masseter muscle. It gives attachment to masseter. Other attachment is on the mandible. So the zygomatic process has anterior root, a posterior root, if you see posterior root, it is arched and it forms a postglenoid tubercle. This is postglenoid tubercle, and this tubercle is more prominent in quadrupeds. And what is the function? It prevents the backward displacement of the mandible. Okay, so both the anterior root of zygomatic process, anterior and the posterior root, both root meet at a tubercle. This is tubercle on which both the anterior and the posterior root is meeting, and this tubercle gives attachment to lateral temporomandibular ligament. So in here you could see a ridge is present here on the lower and the posterior part of the temporal bone. So this is present on the squamous part. This ridge is known as supramastoid crest, and this crest gives attachment to temporal fascia. So the squamous part of bone extend further 1.5 centimeter below this supramastoid crest. Another important feature you could see on external aspect is the opening of external acoustic meatus. This one is the external acoustic meatus. So the squamous part forms the roof and the posterior wall. Roof and the posterior wall of external acoustic meatus. So on the posterior-superior aspect of this external acoustic meatus, there is a triangular area present here. This is known as suprameatal triangle of McEwen. This one. This triangular area is known as suprameatal triangle of McEwen. What is the important? The mastoid air cells is present around 12 to 15 millimeter below this triangular area. But in case of newborn, the mastoid air cells is much superficial, around 2 mm deep to this triangular area, and in case of adult, the air cells is around 15 mm deep to this suprameatal triangle of McEwen. And in children it is much superficial, but as the child grows, it goes deeper to deeper, around 1 mm each year, around 1 mm each year, until the adult position is achieved. Now come to this mandibular fossa. Mandibular fossa has two parts, articular part in front. This is articular part which articulates with the mandible, the condyle of the mandible, and it is formed by the squamous part of the temporal bone. Another part of the mandibular fossa is non-articular part, and this is formed by the tympanic part of temporal bone. So this whole area is known as mandibular fossa. It has a articular part, a non-articular part. Articular part is formed by the squamous part of the temporal bone, while the non-articular part is formed by the tympanic part of the temporal bone, and both part is separated by squamotympanic fissure. Squamotympanic fissure. This fissure is again subdivided by a thin plate of bone which projects from above, to divide this fissure, squamotympanic fissure. So what that thin plate of bone is known as? That is known as tegmen tympani. So tegmen tympani projects from above, from here. It is a part of petrous bone. It projects downward and divide this squamotympanic fissure into petrosquamous and petrotympanic fissure. Okay. So from the petrotympanic fissure, three important structures emerge. That is important and frequently asked question. That nerve is cauda tympani nerve. then anterior ligament of malleus, and tympanic branch of maxillary artery. So three structures emerge from the petrotympanic fissure. These are quadritympanic nerve, anterior ligament of malleus, and tympanic branch of maxillary artery. Now come to the mastoid part. This is the mastoid part. Okay. This part is tympanic part and this part is mastoid part. So it is thick and lies behind the squamous part, and it has an external surface, an internal surface, a superior border and a posterior border. Okay, first come to the external surface. It is rough and convex. Okay, it is rough and convex. The mastoid part altogether gives attachment to almost 5 muscles. Those are occipital belly of occipitofrontalis muscle, auricularis posterior muscle, sternocleidomastoid, splenius capitis muscle, and longissimus capitis muscle. All these muscles are attached along the external surface of the mastoid part of the temporal bone. This projecting part you could see one part is projecting. In articulated bone also you could see this is temporal bone, this one is temporal bone, and a part of bone is projecting here. Similarly this projecting part is known as mastoid process of the temporal bone. It is not present at the birth but appear later when the child starts holding his head. Due to the pull of sternocleidomastoid, this mastoid process develops. So if you see medial to this, there is a groove present here. This groove in articulated skull also, it is more prominent here. This groove, this is mastoid process. This one is the mastoid process. This is mastoid process, and here is the groove. This groove's attachment to the posterior belly of digastric muscle. So this groove gives attachment to posterior belly of digastric muscle. So if you see the inner surface of this mastoid part of the temporal bone, you could see here is presence of sigmoid sulcus here. This is sigmoid sulcus, deep sulcus, bony groove is present here. This is known as sigmoid sulcus, and here lodges the sigmoid sinus. Now come to the superior border and the posterior border. The superior border, this is serrated. It articulates with the parietal bone, lower border of parietal bone on the most posterior aspect, while the posterior border of temporal bone, it articulates with the occipital bone. So here is the articulated skull. This one is mastoid part and this is parietal bone. So in posterior aspect, it is articulating with posterior lower border of parietal bone, and its posterior border is articulating with the occipital bone. Now come to the tympanic part. This is the tympanic part. This one. This is the tympanic part. This one. Tympanic part of the temporal bone. So this tympanic part has a anterior surface, it has a posterior surface, it has a superior border, inferior border, and a lateral border. So anterior surface of the tympanic bone, it forms the non-articular part of the mandibular fossa. This was the mandibular fossa. This one is articular part which is formed by the squamous part of the temporal bone, and this non-articular part is formed, this one is formed by the tympanic bone. So anterior surface of tympanic bone forms the non-articular part of the mandibular fossa, while the posterior surface, this one is anterior, this one is the posterior surface, and this is the external acoustic meatus. So the posterior surface form anterior wall of the external acoustic meatus. So posterior surface form anterior wall of external acoustic meatus. This is superior border. It is articulating with the squamous part of the temporal bone. It has an inferior border. Inferior border here splits. It splits to enclose this styloid process of the temporal bone. You could see here it is splitting inferior border. Let me show you in a articulated skull. If you could see, no, in articulated skull, it is not that much prominent. So here you could, if you could appreciate, so this is the inferior border of the tympanic plate, and it is encroaching on the styloid process. Actually, this inferior border splits to enclose the styloid process of the temporal bone. And another border is a lateral border. Lateral border is forming the margin of the external acoustic meatus. It has an upturned end and it is meeting the mastoid process. So this fissure, tympanomastoid fissure, is formed here between the upturned end of the lateral border of tympanic part of the temporal bone and the mastoid part. So here is formed one fissure, and this fissure is known as tympanomastoid fissure, and through this one important structure traverse, which is known as auricular branch of vagus nerve. So through tympanomastoid fissure, what is passing? Auricular branch of vagus nerve. So now come to the petrous part. This is petrous part. This is petrous part. So it is pyramidal in shape. So this petrous part has one base which is merged or articulate with the squamous and the mastoid part of the temporal bone. So it has a apex. This one the base which is attached to the squamous and the mastoid part of the temporal bone. It has a apex. It has a superior border. So it has a superior surface, posterior surface and inferior surface, and also three borders: anterior border, superior posterior border and the inferior border. So it has three border actually. One correction is there. There is one anterior border, this superior border and a posterior border. No inferior border is present. Anterior border, superior border and a posterior border. Now come to the apex. This one is apex. So apex, this is the apex. It is irregular and blunt area. It projects forward and medially with slightly upward tilt. Like you have to hold it like this. You can see here. This is forward and the medially with slightly upward tilt. So if you see the apex, here is one opening. This opening is for the carotid artery, and this opening is for the carotid artery, and this opening is known as anterior opening of carotid canal. So carotid artery enters inside the cranium through this opening. It enters through the lower opening of the carotid canal, and then it come out through the bony canal through the anterior opening and enters inside the skull, inside the cranium. Okay, so this is the anterior opening of carotid canal which is present in the apex, and in articulated skull this apex forms posterolateral boundary of foramen lacerum. Foramen lacerum. In articulated skull it forms the posterolateral boundary of foramen lacerum. So This is the petrous part, this one is apex, and this is the foramen lacerum. This is called lacerum because it has no definite margin and it looks lacerated. So lacerated opening is present here. This is known as foramen lacerum, and it is contributed in posterolateral part by the apex of petrous bone. So tip, this is the tip of the apex. It gives attachment of petrosphenoid ligament. One end is attached here and another end is attached on the petrosal process of the sphenoid bone. So below this petrosphenoid ligament, what passes? Passes the abducent nerve. Abducent nerve passes below this ligament. So now among surfaces, you have anterior surface, a posterior surface and an inferior surface. So this one is the anterior surface, this one is anterior surface. So close to apex, you could see a shallow area here, it is present. This area is known as trigeminal impression. Shallow depressed area is present here near the apex of the petrous part of the temporal bone. This is known as trigeminal depression, which lodges the trigeminal ganglia, which is the sensory ganglia of fifth cranial nerve. This one here. So the ganglia is present in the cavum trigeminale or Meckel's cave, which is a pouch of dura mater. So trigeminal ganglia is present here in a pouch of dura mater, and this area is known as trigeminal area, which lodges the trigeminal ganglion of fifth cranial nerve, which is a sensory ganglion. Okay, behind this depressed area, the anterior surface forms the roof of internal acoustic meatus, this part. And if you go further behind, you will see one elevated area is present here. Elevated bony part is present here. This is known as arcuate eminence, and it is formed by upward bulging of anterior semicircular canal, this one. So on anterior surface, what we got? There is trigeminal impression, then the part of bone forms the roof of internal acoustic meatus. Behind that there is elevated area. This one is elevated area. This is known as arcuate eminence, which is formed by the upward bulge of anterior semicircular canal, and the rest of the anterior surface of the petrous part of the temporal bone forms tegmen tympani. This tegmen tympani projects downward and divides the squamotympanic fissure into petrosquamous and petrotympanic fissure. Through the petrotympanic fissure, three structure was emerging: the cauda tympani nerve, anterior ligament of malleus, and anterior tympanic branch of maxillary artery. Now come to the posterior surface. This was the anterior surface on which I have showed the trigeminal impression, then the roof of internal acoustic meatus, arcuate eminence, and the rest of area forms the tegmen tympani. Now come to the posterior surface. Posterior surface, here you can see one opening is there. This opening is the opening for internal acoustic meatus. What structure is passing through this opening? It transmits the motor and sensory root of the facial nerve, and it also transmits the cochlear nerve and labyrinthine artery. So three important structure is passing through this internal acoustic meatus. Now come to the inferior surface. So this was the anterior surface, this was the posterior surface. Now come to the inferior surface. Inferior surface, in most anterior part you will see a quadrilateral area which gives attachment to one muscle which is known as levator valli palatini. So this gives attachment to levator veli palatini, and when this part articulates with the greater wing of sphenoid, it also forms the sulcus tubi. So in inferior surface you will get one quadrilateral area which gives attachment to levator veli palatini, and you will get one opening. Here this opening is known as lower opening of carotid canal. Through this opening the internal carotid artery enters inside the bone and then come out through the anterior opening of the carotid canal, which is present at the apex. So this one is the lower opening of carotid canal. So quadrilateral area, then lower opening of carotid canal. What else you got? Just see behind this carotid canal one depressed area is present here. This is known as jugular fossa, which lodges the superior bulb of internal jugular vein. So in between these lower opening of carotid canal and the jugular fossa, you could see one opening is present here. In between these two, one opening is present here, this foramen. This is known as tympanic canaliculus, and this transmits the glossopharyngeal nerve. Now come to the stelloid process. So this thin projection of the bone from the lower part of the temporal bone is known as the stelloid process. It is around 2.5 centimeter long, and it extends downward and forward. This bone develops from the second branchial arch. So it gives attachment to 3 muscles and 2 ligaments. What are the muscles? Muscles are styloglossus, stylohyoid and stylopharyngeus, and 2 ligament is attached here, that is the stylohyoid ligament and stylomandibular ligament. Just behind this stelloid process you could see one foramen is there. This foramen is there. This is known as stylomastoid foramen. So this stylomastoid foramen transmits the facial nerve. From here there is an exit of facial nerve take place through this foramen. The exit of facial nerve take place through this stylomastoid foramen. So in case of children, this foramen lies much superficial because in them the mastoid process is not well developed, and this foramen lies much on superficial surface. So any incision behind the pinna in case of children should be done carefully to avoid the damage to this facial nerve. Now come to the borders. This one is the anterior border, this one is the superior border, and here is the posterior border. So anterior border in the medial part, it articulates with the posterior margin of greater wing of the sphenoid and forms the sulcus tubi on the undersurface of base of skull. Okay, and in anterior border you could see 2 foramen is there. This one is the upper, this one is the upper foramen, and here is the lower foramen. 2 foramen is there. The upper canal transmits the tensor tympani muscle. This upper canal transmits the tensor tympani muscle, while the lower canal, lower canal, it forms the bony part of auditory tube. So along the anterior border you could see 2 canals is there. One is upper, one is the lower. Upper canal transmit the tensor tympani muscle, while the lower canal forms the bony part of auditory tube. This is the superior border. This is the longest border, and it gives the attachment to tentorium cerebelli. Okay. So it gives attachment to lateral border of tentorium cerebelli. Here you could see one groove is present. This is for the superior petrosal sinus. Okay. Now come to the posterior border. This one is the posterior border. In medial part it is articular, and in the lateral part it is non-articular. Okay, medial part articulates with the basilar part of the occipital bone, and if you see the base of skull, there is after articulation with the occipital bone, one groove is formed which lodges the inferior petrosal sinus. The lateral part, it forms the superolateral boundary of jugular foramen. Now come to the ossification. So the tympanic part and the squamous part, tympanic and squamous part ossifies in membrane, while the rest of the part of this bone like petrous, mastoid, stelloid process all ossifies in cartilage. Now anatomical position, how to hold the bone, how to determine the site. The beveled margin should face upward. This thin plate of bone should face upward. The stelloid process should face downward. So in this stelloid process should face downward. The petrous part, this petrous part should face forward and medially with slightly upward tilt. Okay, so and the external acoustic meatus, the opening should be on the outer aspect. So if I hold bone by keeping consideration of these points, so I could see this is a bone of right side. This is a right side temporal bone. Lastly, to summarize, a temporal bone is a paired bone, pneumatic bone. It is irregular type of bone. Shape is not regular, irregular. It has few parts. The parts are squamous part, which is a thin translucent part of bone and projecting upward. It has a mastoid part which lies behind the squamous part. It has a petrous part which is pyramidal in shape. It has a stelloid part which gives attachment to 3 muscle and the 2 ligaments, and it has a zygomatic process which is a part of the squamous part of the temporal bone. Zygomatic process has apex, a base, and it articulates with the temporal process of the zygomatic bone to complete the zygomatic arch. It has a mandibular fossa which has a articular part, a non-articular part. It has opening of external acoustic meatus on the most outer aspect or external aspect. It has a mastoid part, and the projecting part is known as mastoid process. And here just behind the mastoid process there is a notch which is known as digastric notch, which gives attachment to posterior belly of digastric muscle. This is all about the temporal bone. Thank you.